We are group number 5, and we will be going over can or should we treat substance use disorder with psychoanalysis or psychodynamic treatment. In our group, Anna Scano, Gracie Felice, Crystal Hippolyte, Hin Yafai. Our agenda today will go over the introduction. We'll define psychoanalysis and psychodynamics, its involvement with opioids, alcohol, tobacco. Then our references, and we'll move on to our question and answer portion.
Hi, I am Gracie, and I am going to introduce the presentation with some definitions. Psychoanalysis is a form of therapy and a theory of mind that comes from Sigmund Freud's work from the early 1900s. In simple terms, it says that a lot of what we think, feel, and do is influenced by unconscious processes, wishes, fears, and memories we are not fully aware of. These hidden conflicts often start in early childhood and can show up as anxiety, depression, relationship problems, or symptoms like addiction or phobia. Psychodynamic. Psychodynamic therapy is a shorter, more flexible form of psychoanalytic treatment that focuses on how past experiences and unconscious patterns affect a person's current life and relationship. It still uses core ideas from psychoanalysis, such as unconscious conflicts, defense mechanisms, and transference. But it is usually once a week, time limited, and more focused on a specific problem or theme. When we talk about treating substance use disorders today, most guidelines focus on medications and behavioral therapies, such as CBT, motivational interviewing, and contingency management. However, there is also a long-standing psychoanalytic and psychodynamic tradition that views addiction in terms of unconscious conflict, affect regulation, and relationships. The big question for this topic is, can or should we treat SUD with psychoanalysis or psychodynamic treatment, and what do they realistically contribute, especially for alcohol, tobacco, and opioid use disorders? Psychoanalysis and psychodynamic therapy both originate from Freud's work and subsequent development. They emphasize how unconscious processes, early relationships, and defense mechanisms influence current behavior, including substance use. In SUD treatment, psychodynamic approaches view substance as a way of self-medicating painful feelings, trauma, or underlying psychiatric issues, rather than simply bad choices. The therapy explores what emotional state the person is trying to manage with alcohol or drug use, recurring patterns in relationships, including with the therapies, how early experiences of family, loss, and trauma influence current behavior. Here are some overall answers to the question. Can we? Yes. Psychodynamic approaches can be used with SUD, especially when people have long-standing emotional conflicts, trauma, or personality difficulties. They can help explain why the person uses and support deeper changes in self-understanding and relationships. Should we use them as the only treatment? For substances like alcohol and especially opioids, the answer is generally no. The evidence strongly supports medication plus structured psychosocial treatments as the first line care. Using only psychoanalysis or long-term psychodynamic therapy without medication would ignore life-saving options. Best position. Psychodynamic therapy is best viewed as one piece of a comprehensive treatment plan, not a competitor to medication. It can add value by addressing underlying emotional pain, relationship patterns, and relapse triggers, while medication and other behavioral treatment directly reduce use, withdrawal, and overdose risk. Now let's go over some advantage and disadvantage. In the aspects of relapse and patterns, the advantage is that it helps clients notice repeated patterns. Could be about shame, abandonment, and binge, and this can support long-term changes. The disadvantage is that it might stress insight more than practical tools for reducing use and staying safe. In the aspect of emotional and trauma, the advantage is that allows deeper work on shame, grief, anger, and trauma underlying addiction, often missed by brief approaches. And the disadvantage is that intense emotional work can destabilize clients whose use is indeed medically or behaviorally stabilized. In the aspect of sense of self and identity, the advantage is that works on self-esteem, identity, and internalized stigma, such as I am bad or I am a failure, which reduce self-destructive behavior over time. And the disadvantage is that change in these areas is usually slow, and system focus on quick outcomes might be seen as little short-term progress. In terms of time and structure, the advantage is that it's flexible, can follow what emerged in the client's mind, not just a manual. And the disadvantage is that it's often long-term, less structured and time-consuming, and it can be expensive and less accessible in some settings. Finally, in terms of cultural and social context, the advantage is that when done well, it can explore how family, culture, and history shape the person's internal world. And the disadvantage is that when done poorly or narrowly, it might focus mainly on the intrapsychic and ignore a structural operation and social determinants of health. In our group, we argue that socioanalytic and psychodynamic treatment can play an important role in treating SUD, but should not replace evidence-based medication and behavioral treatments, especially for alcohol, tobacco, and opioid use disorders. Each of my group members will now show how this plays out with alcohol, tobacco, and opioids.
What are opioids? Opioids are a class of drugs that work on a specific receptor in the brain to block pain signals. They often are prescribed for moderate to severe pain, but can also trigger strong feelings of euphoria, which increase the risk of misuse and dependency. Some common types of opioids are oxycodone, commonly prescribed under the brand name like OxyContin and Percocet. It's used medically but carries a high risk factor for addiction when taken in large doses or without a prescription. Heroin, an illegal opioid derived from morphine. It's often injected, snorted, or smoked, and is also known for its rapid and intense high, which can quickly lead to dependency. Fentanyl, a synthetic opioid that's 50 to 100 times stronger than morphine. It's used medically for severe pain, but is also produced illegally and mixed with other drugs, making it extremely dangerous and a major cause of overdose death. Even though these drugs differ in forms and legality, they all share similar risks. Misuse can lead to tolerance, dependency, and withdrawal symptoms and overdose, which can be fatal. This slide looks at whether psychoanalysis or psychodynamic therapy can help treat opioid addiction and what are their limits. Psychoanalytic and psychodynamic therapy focus on exploring the unconscious mind, the hidden emotions, memories, and relationship patterns that shape behavior. It helps people understand the why behind their drug use, often tied to early life experiences, emotional pain, or trauma. Some possible benefits of these therapies: they can help increase emotional awareness and insight. They teach people to recognize triggers, understand their inner conflicts, and develop healthier coping skills. They're especially helpful for individuals who have a history of trauma, depression, or other mental health challenges that contribute to substance use. By itself, psychodynamic therapy is not enough to treat opioid addiction, particularly for strong opioids like heroin and fentanyl. Because addiction has powerful physical components, treatment must also include medical approaches such as medication-assisted therapy, detox, and behavioral support. In short, psychodynamic therapy can help address the emotional root of addiction, but it's most effective as a part of a combined treatment plan, not as a standalone solution. This slide compares both sides, the evidence for and against using psychodynamic therapy alone versus combining it with medication in treating opioid addiction. Studies have found that when psychodynamic therapy is paired with medical treatment, it can support long-term recovery. It helps people process emotional pain, understand triggers, and strengthen motivation for change. And it's been shown to work about as well as other types of talk therapy when part of a full treatment plan. Against. However, relying on therapy alone is risky because opioid addiction can change the brain's chemistry. Stopping use without medical help often leads to relapse or even fatal overdose. That's why medication for opioid use disorder, like methadone, buprenorphine, and naltrexone, is considered life-saving. These medications reduce craving, prevent withdrawal, and make recovery more stable. The most effective approach is both medication and therapy together. Medication addresses the biological side, easing craving and protecting against overdose, while therapy focuses on the psychological and emotional side, helping people rebuild their lives and maintain recovery. Opioid addiction isn't just physical or emotional, it's both. Medication helps the body heal and stabilize, while therapy helps the mind recover and grow. When used together, they create a safer, stronger path towards lasting recovery.
What is alcohol? Alcohol is a central nervous system depressant that slows down the brain and body. Common forms are beer, wine, liquor, and the dangerous ones are the methanol and isopropyl. Its effects, it has short-term and long-term effects. The short-term include feelings of relaxation and disorientation, slower reaction times, and decreased coordination and compromised judgment. So the long-term include damage to the liver, heart, and brain, as well as higher likelihood of developing an addiction to alcohol. Can psychoanalysis or psychodynamic therapy treat alcohol addiction? Yes, it can, and there are ways they assist individuals in doing that. So the first is that they assist an individual's exploration of some of the following, which are unconscious emotions, past experiences, and inner turmoil, because those are what is motivating the individual to consume alcohol. They also assist in understanding of the reasons why individuals consume alcohol, such as dealing with trauma, stress, and or unresolved feelings. They also provide individuals an increased awareness of their emotional state, increased self-control, and assist them in developing alternative means of dealing with problems. But there are also limitations to this therapy, which is that they may take time to be effective and may not be the only effective or supportive method for a person using excessive amounts of alcohol. And also most people respond best to treatment when combined with medication or other therapies and or support groups. What does the evidence say? So there are evidence that indicates that many studies have confirmed that using psychotherapeutic techniques help reduce alcohol intake and improve emotional well-being, and especially when combined with either medical or behavioral treatments. And there is also research that goes against, stating that even when done in combination with therapy, recovery from heavy or long-term drinking can be ineffective. There may be higher relapse rates, which makes it clear therapeutic methods alone will not achieve long-term abstinence for alcohol use disorders. And lastly, utilization of medications, naltrexone, acamprostate, and or dislorpirma, can aid in recovery from alcohol use disorders. In summary, alcohol dependence affects each individual by developing both psychological dependence upon alcohol along with physical dependence, and also medications used for the treatment of alcohol use disorders reduce cravings and support treatments treatment by helping alcoholics overcome associated emotional issues so as to sustain long-term recovery from alcohol.
What is nicotine/tobacco? Nicotine is a highly addictive stimulant that's found in cigarettes, cigars, vapes, and smokeless tobacco. It affects the brain very quickly by activating the reward pathways, which is why dependence can develop very rapidly. Some of the most common forms of nicotine here listed include cigarettes and cigars, vaping or e-cigarettes, and smokeless tobacco like chew. Nicotine creates several short-term and long-term effects. In the short term, it causes a rapid release of dopamine, which leads to cravings and reinforces the habit as well. It also increases alertness, raises heart rate, and changes the way the body reacts to stress. Over time, nicotine use can cause serious health problems that can include lung disease, cancers, as well as cardiovascular damage. So what's important to remember is that nicotine addiction isn't just physical. It develops because of biological, behavioral, and emotional factors. That's why approaches like psychodynamic therapy can be helpful. They look beyond the behavior of smoking and explore the deeper motivations behind it. How psychodynamic therapy works. Psychodynamic therapy is based on the idea that our behaviors, such as nicotine use in this circumstance, are often influenced by unconscious patterns we may not be fully aware of. Instead of only focusing on the act of smoking or vaping, this type of therapy tries to understand the emotional and psychological reasons behind the habit. This might involve uncovering unconscious motivations, unresolved emotional conflicts, or relationship patterns that shaped how a person learned to cope with stress. Many individuals use nicotine as a way to self-soothe or manage difficult emotions, even if they don't consciously recognize that connection. The goals of psychodynamic therapy include increasing insight into why someone smokes, strengthening healthier coping mechanisms, reducing emotional triggers that make relapse more likely, and improving overall self-awareness and emotional stability. So, rather than treating the substance itself, psychodynamic therapy treats the emotional system underneath the addiction. It helps the person understand why they reach for nicotine, which can make long-term recovery more meaningful and sustainable, really. What does the evidence suggest? When we do look at research, we see both strengths and limitations of using psychodynamic therapy for nicotine addiction. On the supportive side, studies do show that psychodynamic therapy can improve emotional regulation, increase self-awareness, and boost motivation, which are three major factors that play a role in addiction recovery. These emotional and psychological gains can have long-lasting benefits for individuals trying to change addictive behaviors. However, there are also important limitations. Nicotine dependence progresses biologically in ways that insight-based therapy alone cannot reverse. Addiction to tobacco has strong biological components that often require additional medical or behavioral interventions. Nicotine withdrawal symptoms that include irritability, headaches, restlessness, increased appetite, and trouble concentrating are also significant. These withdrawal effects typically require structured interventions like medication or evidence-based behavioral treatments, not just emotional insight. So the overall takeaway is that psychodynamic therapy can be a valuable tool for understanding the emotional roots of nicotine use, but insight by itself is usually not enough for full recovery. combining therapy with medical and behavioral supports tend to produce the strongest outcomes.